Hi Sylvia, thank you for coming in and seeing me today. My name is Jesse Trung and I'm an exercise physiologist. I can see that your doctor has referred you to our clinic for your chronic lower back pain.
Yes, that's right. It happened about 3.5 months ago when I was trying to lift a box off the floor,
Mm-hmm.
and then I feel a grabbing pain.
Okay. And whereabouts was the pain?
Just lower back in the middle.
Yeah, beautiful. And did you feel any other sensations such as tingling or anything like that?
No.
Um, so after the incident, did you see a doctor straight away or?
Well, at first I iced for a couple of days
Mhm.
and have it take some Panadols along, and then that didn't help, so I have to go and see my GP, who then recommended me to see the physiotherapist.
Mhm.
Once I was there, he gave me a really good massage and a few exercises to do at home,
Mhm.
which I found was helpful. But then I often, when you feel a bit better, you kind of stopped.
Yeah, definitely.
And then when the pain flares up again, I sort of forgot the exercises.
Yeah. And how often would you have a flare up?
I think every couple of weeks.
And how do you manage that?
Panadol. Yeah, just take Panadol.
And then did you go back to see the physio at any point in time, or did you just wait it out till the pain subsided?
I went back to the physiotherapist. Yeah.
That was for the extra massage and bit of exercise.
Yeah, that's right.
Perfect. What type of employment are you in, Sylvia?
I'm a full-time receptionist. So my job is basically sitting at my desk all day.
Perfect. So how often would you get up out of your chair?
Rarely, because I'm very busy at work.
Yeah.
And I do try to get up and go for a walk as much as I can, but sometimes it can be hard.
So would you say your workplace is a high-paced, stressful environment?
Yes, it is, yeah.
So lower back pain is very common in office workers due to the poor posture and the prolonged hours of sitting. So it is recommended that you get up to alleviate the pressure every 20 minutes or so. Back to the referral. I can see the GP has elected to change from physio to exercise physiology. Have you been to an exercise physiologist before?
No, never.
No problem. No. So what I'll do is I'll give you a quick information sheet just for your reference in the future. So after this consultation, if you don't understand, the information is there for you. But basically, we use exercise and education together to tackle pathologies that affect everyone from kids to middle-aged to the elderly as well. Alrighty. So while you were waiting for me, you did an exercise screening tool. Did you have any difficulties performing or completing that? Sorry.
No, it was pretty straightforward.
Yeah. Well, I'll just quickly run it through with you just to make sure that the answers are correct. We use this tool just to indicate or flag any potential barriers that may occur whilst doing physical activity. So when you're performing under stress, these things could pop up if you do have them. So have you ever had a heart condition or ever suffered a stroke?
No.
Have you experienced any chest pains during physical activity?
No.
Have you felt faint or had spells of dizziness during physical activities?
No.
Have you had any asthma attacks within the last 12 months?
No.
Do you have type 1 or type 2 diabetes?
No.
Do you have a diagnosed muscle, bone, joint problems that have you ever been told could be made worse by participating in active activities or exercise?
No.
Do you have any other medical conditions that make it dangerous for you to participate in?
No.
Sylvia, sorry, just your age?
I'm 44, going on 45.
Have you had any family history of heart disease or anything like that?
No.
Do you smoke?
No.
Do you exercise?
Yes.
How often would you exercise?
5 times a week.
And how long is each session?
Each session is 1 hour.
And your height is 159 and your weight is 61 kilos, is that correct? So that gives you a BMI of 23, which is within the normal BMI range. So that's really good news. Do you have any high blood pressure?
No.
High cholesterol?
No.
High blood sugar?
No.
Have you spent any time in hospital within the last 12 months?
No.
Do you take any prescribed medications?
No.
So this wouldn't include Panadol.
No.
You're not pregnant or have you given birth in the last 12 months?
No.
Do you have any muscle, bone, joint pain or soreness that is made worse by particular types of activity?
Yes.
Okay. So what type of activities trigger your pain?
I think running.
Running, yeah.
Yeah. Or bend down. Certain exercise moves.
And do you struggle picking up weight, or what's your maximum weight limit that you could pick up?
Well, I think on a good day, 7 max. Yeah.
7 kilos?
Yeah, 7 kilos, yeah.
How many hours of sleep do you get each night?
7 to 8.
Yeah, that's good. How often would you have takeaway food each week?
Probably twice a week.
Yeah. And would it be more fast food or restaurants or cafes?
Mix.
Yeah. Do you know anyone else who has a history with lower back pain?
Yes.
Okay. Are they from work or?
Yeah.
Yeah.
I find people like when the job that they require sitting a lot, then I find that their backs usually in a lot of pain.
Have you experienced any mood concerns over the last couple of months?
Yes.
Okay. Is that because of the same injury occurring, or?
Yes.
Yeah.
That's right.
Is that because it's lingering, or?
Yeah, because it's keep on coming back, and I'm very concerned whether can it be treated or is this a long-term thing?
Yeah. Have you had any imaging completed by the doctor?
No.
Has he mentioned it at all, or has he just said, see if we can manage this conservatively before we investigate any further? Is that what he said, or?
Yeah, he just said just try the exercises and do the physio and all the painkiller first.
So yeah, back pain is normally quite frustrating because it happens so often. So once you have it, it does tend to come back in patches. So with the exercise, we will aim to reduce the amount of time that you're affected by it. If we can cut it out, that's even better. Do you have any other questions for me at this point in time?
No.
Perfect. So yeah, thank you so much for your time, Sylvia. And yeah, I'll assess the results and we'll be in touch.
Thank you.